ITEC, the International Training and Education Center for Health, a center in the Department of Global Health at the University of Washington, Seattle, prepares clinicians to be leaders in HIV care, treatment and management in India through a HIV fellowship program. The HIV Clinical and Leadership Fellowship is conducted at the Government Hospital of Thoracic Medicine, also called GHTM, in Chennai in South India. GHTM is one of Asia's largest HIV/AIDS care centers. The fellowship program, approved by the government of Tamil Nadu and supported by the Tamil Nadu State AIDS Control Society (TANSACS) and the Directorate of Medical Education, is funded by the United States Centers of Disease Control and Prevention (CDC GAP) and technically supported by ITEC.
Government to government partnership. It was US government and Indian government and the state of Tamil Nadu government. Then bring in the University of Washington into it through ITEC. It's a private-public-private partnership.
And we identified ITEC as a good organization. It has a lot of experience, it has a lot of training work that is being done in other countries. And so we wanted that expertise to be brought into India.
The Government Hospital of Thoracic Medicine, where the ITEC HIV Fellowship Program is implemented, is one of the first NACO-designated centers of excellence and has over 30,000 HIV cases registered till 2008. The hospital houses 5 HIV wards, 3 antiretroviral therapy or ART wards, 1 pediatric ward and an exclusive palliative care ward, in addition to an intensive care unit and a state-of-the-art laboratory. The hospital has over 13,000 patients on first-line ART and is also one of the centers selected by NACO for the provision of second-line ART treatment and alternate first-line ART. ITEC GHTM Fellows have privileged access to one of the best equipped laboratories in the country, which screens more than 1,000 samples for HIV and CD4 count daily.
We are having a morning, it's a clinical side, and the afternoon is a theoretical aspects. Clinical side we are taking care, and at theoretical side ITEC is taking care.
During their ward postings at GHTM in the mornings, fellows are exposed to a myriad of HIV cases.
If you still feel malignancy, you have to talk about that.
Along with a GHTM doctor, each fellow, on an average, gets to provide direct patient care to 40 inpatients and 60 outpatients every day. So that, by the end of the fellowship, each fellow will have had more than 10,000 patient encounters with a range of care issues including management of opportunistic infections, first-line and second-line ART therapy, palliative care, and psychosocial support. A truly unparalleled learning experience.
It has a public health and a management component which has not been covered even in MBBS program. And it is rooted at GHTM, which has a plethora of HIV cases which you won't see in any part of the world. I would say the first thing is the clinical one. Like even if you don't want to learn, like you will learn.
Unlike in other fellowship programs where learning opportunities may end with patient encounters, on the ITech GHTM fellowship, it just begins there. GHTM holds the State AIDS Clinical Expert Panel meeting once a week to review and identify the patients with first-line ART failure and decide on initiating them on second-line ART if necessary.
Probable oral candidiasis, loss of weight, breathlessness, everything. But this actually...
And ITech fellows are privileged to actively participate in these meetings and learn about clinical expert panel.
I feel that all cases, like varieties of cases you see in GHTM Tambaram, the first line ART patients, the second line ART, the state expert panel meetings on second line ART, this is unique compared with other fellowship programs run in many parts of the world.